The Katutura State Hospital receives about 30 to 35 people requiring admittance on a daily basis. Despite the hospital opening a coronavirus admission unit with 74 beds, these have since their introduction remained constantly full. The entire fourth floor of the hospital, comprising of 64 beds, is dedicated to an ever-increasing number of patients. Its fourth floor now full as well, the hospital is currently busy upgrading, adding another 46 units to accommodate more COVID patients.
We are even now re-looking at decongesting other floors, like the fifth floor, to make that a COVID space as well. And when you look at Central Hospital, 1 East 30 bed is a COVID ward, full to capacity. 2 East is a COVID ward, full to capacity. 3 East currently is being prepared as a COVID ward, a 30 bed. These are all 30 bed units. You've got the COVID-19 prefab isolation units, 24 beds, full to capacity. Then we have the military hospital, 24 bed capacity, where we want to decongest patients from the critical areas to create more space and take those more stable patients there. That one is also filling by the day. And what you're beginning to realize is that until we do drastic measures, we may not turn the tide. And the solution here is vaccination. And that is really the important thing out there. Namibians, you need to go and vaccinate. The health workers are stretched thin to the maximum. There is no more extra doctors and nurses and social workers, psychologists, physiotherapists to pull. There is no bag to pull from to even staff some of these extra spaces we are opening. We have to pull from the already strained, understaffed quota. And I know people are out there having these myths and ideas about vaccination. And I want to say your risks and your concerns and your fears about vaccination, let's say with the AstraZeneca, people are worried about blood clot. That risk of getting a blood clot from the AstraZeneca vaccine is almost, I would compare it to the risk of you sitting in a full football stadium and wondering whether the ball which is being kicked among footballers is going to come and hit you on your head. That is the risk of you getting a clot from the AstraZeneca vaccine.
She says not getting vaccinated is the riskier choice, considering the low number of vaccinated people requiring hospitalization.
And what the vaccination will do is improve your immunity such that should you get COVID-19, it is COVID-19 that is mild enough for you to be sitting at home, drinking ginger tea, getting supportive treatment and recovering within a week and a half, and going back to being a productive member of society.
The unending wave of new COVID-19 patients has frontline workers struggling to cope.
Those patients that are coming cannot afford our 2 weeks at home to recover so we can come back and nurse them. So really, I'm appealing, do us a favor, do yourself a favor, go and get vaccinated. Please, I am begging. I myself, I'm a COVID recoverer. I got COVID, I don't know, out there in the community, maybe at work, I don't know, but I got it. And I had to be laid off for a week, but I had to come back because there is work to be done here. So I'm saying I'm one of the lucky few who managed to be able to be treated at home, recover, and come back to work. But there are Namibians who are not going to be that lucky. I've seen healthy as a hawk's individuals who get this thing and they don't do well. They progress from mild to severe to critical COVID and they have died. I have buried a family member. Others will be reporting burying 3-4 family members. So it's not a joke. It's not a joke.